Well, every Sunday, whenever possible, we have a chance to talk with the Health and Social Care Minister, David Ashford, and here he is today. I thought the first section anyway, we will just do an update because as it stands today, I don't think it's going to be a press conference. The business with the cervical smears is definitely been causing contention and upset and even a petition. And you stopped it, but you've now put it back on. Can you give us more details?
Yeah, in relation to the surgical smears, they were stopped during the previous two lockdowns. So, because obviously it does involve quite close contact with the patient, should we say, and the medical professionals themselves felt there was a risk around that, so it has been risk assessed. In relation to suspension of services, that's a clinical decision, it's not a political decision. So I wasn't aware that the smear service was being stopped until I was contacted late the other night. My personal view is that it's exceptionally important to women's health. So although it's a clinical decision, not a political one, I raised concerns and asked if the clinical team could review it. They did so yesterday morning, and the Director of Public Health and the clinical team confirmed that they felt that it could continue. And therefore GPs have been advised that they can continue with cervical smears.
So this wasn't happening at Nobles then, this was at GPs, was it?
Yes, this is the GPs, it's primary care.
So maybe people are confused why it would stop, because I mean GPs are still seeing people, I understand, aren't they, or not?
They are, but it's limited. We've gone back to where we were during the last lockdown, where GPs will only see people if it is necessary and required, and there has to be the full PPE requirement as well. But because of the invasive nature of the smear procedure, in previous lockdowns it was suspended because it was felt that there was a risk there. Both to the patient and the GP, but the Director of Public Health and clinical team, having looked at measures that can be put in place, feel that it can continue, and that's exceptionally good news because, as I say, from my point of view, it's absolutely essential to women's health that does continue.
I did an interview about dentistry. I don't know if you had a chance to see it, but the main core of it was, what do we do? It seems that they're not going, at the minute, allowed to carry on. I'm talking about the private one particularly. They sort of feel there's not enough communication going on with government, and they've got obviously people who need to see them. Anything you can tell us on this? Yeah,
so primary care has been engaging with the dentists around their SOP, which is the standard operating procedure. With the outbreak we have at the moment, it's moving very fast. We know from previous lockdowns how aerosol procedures can actually spread the virus. So it is important we do put certain restrictions at this time on dentistry. We hope that they won't be in place for long. We have a history of being able to get dentistry back up and running fairly quickly. In fact, we were one of the first places in the world after the COVID-19 outbreak last year that actually managed to get dentistry reinstated and up and running. So we would hope to do so again as soon as possible, but we have to remember there is that risk, so we have to take action around that.
And maybe that's the whole thing, because in the UK, I mean, obviously they've been in constant lockdown, but they're pretty well back to normal in most circumstances, I understand. I'm only going by what I'm being told. So could we not just gone straight back to carrying on, but safely, rather than having a complete stoppage?
Well, we have to remember the UK, though, is still seeing spread of COVID-19. They are not attempting to stop that spread. They're attempting to mitigate it. So it's a bit like comparing oranges and pears. When you're talking about the UK and the Isle of Man, because we are in an elimination strategy, which is to remove COVID from our community. The UK is in a mitigation strategy to try and control it.
And therefore, when is it likely that the dentists will have some capacity to start doing some work?
As soon as the spread starts showing itself under control, then we'll do exactly the same as we did during the very, very first lockdown last year. We will start turning services back on as quickly as possible.
Now, I appreciate your numbers come out later today, but obviously people are obviously interested to know how we're doing. Presumably the curve is expected to keep going up. I think it's about Thursday. Is that where we're roughly thinking?
Yeah, it'll be middle of next week. You would expect, because we have to remember that the cases we're seeing now were seeded about a week ago. Just over a week ago, probably. So we will continue to see cases being identified, probably in large numbers, until middle of next week.
And what pressure is that putting on the hospital? I mean, some people are in there on your list saying it's COVID related. Are you okay at the moment? Ventilators being used. What's the situation?
Yeah, we've got one person who's in ICU, I believe, out of the people that have been taken into hospital. But all, as far as I'm aware, are in a stable condition. We are using Ward 19, also sometimes referred to as the private patients unit, because that is split into side rooms. So we have activated that. We went through, as a health service, we went through this last year. So we have got resilience built in there and procedures in to be able to deal with this. We've always been prepared because there was always the chance that COVID-19, which we said from day one, could always come back because it is an invisible virus and it spreads quite quickly. So we had all these plans in place and they've been reactivated. So at the moment we are resilient. There is other plans. Of course, we did the expansion of ICU last year. If we need to do that again, we can do so. But there is plans in place to ensure that Nobles remain secure.
Well, you say you're ready and all that sort of thing, but look at the 111 situation. I mean, totally swamped. It was obviously not doing its job properly because people were getting cut off, then they were waiting and then getting cut off and just constantly frustrated. That was, to be honest, a unique set of circumstances, Paul, that all came together. The law of sod, as I keep saying, sod's law. There was technical issues with the line, which then coincided with also the next set of vaccination letters going out, which was 1,500 letters. And the encouraging news is that people very, very quickly, when they get their letter, want to register. So it's actually encouraging. We are seeing a large take-up of the vaccine across the age groups that we're doing. So they were all trying to contact 111 to book. And then at the same time, we had the school clusters, which rapidly went through schools, which meant that 111 was also having to book testing for those families, but also contact the families to isolate them. And that was a substantial amount of families to be doing. So actually, I think the team on 111 actually coped very well as a team. They've been working long hours, as have other workers across the whole of government. So actually, I'd actually like to pay tribute to them for all the hard work that they've done, and the track and trace team. And you're right, I don't think anyone's knocking the results in the sense of all these hard-working people. I mean, that's totally, I think everyone accepts that. It's just a fact that obviously it's the frustrations there. And isn't it a double issue that you ring this number and then they have to ring you back with the appointment? Can that have not been simplified? And obviously online work these days, as it now starts to get to a younger population who may be more savvy on computers.
Well, as I said at the briefing the other day, we are looking at a digital solution. We have been since the start, because as we move down the generations, you're quite correct, there are people who want a more digital solution. So there will be, which I'll hopefully be able to announce more fully later this week, a way of people going online and registering. We can't really stop the 111 having to ring people back with appointments, because this is down to the delivery schedules of the vaccine. The delivery schedules each week, as I think I've mentioned before, aren't even. So we don't get the same amount of vaccine each week. The delivery schedules can change even multiple times in a day. So what we do is we don't slot people in for an appointment until we know that we've physically got the vaccine to cover that. Because what we don't want to do is put out a load of slots where people can book online, and then we're having to run around cancelling people, either moving them back because we didn't receive the supply expected, or actually trying to bring them forward because we received more than we expected. That would actually create even more work for the team. So the easiest way is for people to be able to register online, so they can register their expression of interest to be vaccinated, but then the team bring them back with the physical booking once we know what the supply for the week ahead is.
Okay, but actually when people make that phone call, are you still saying that that's exactly the same thing that's applying to that situation? They can't just look in their diary and go, yes, Mr. Jones, you can have 2:30 on Wednesday. There and then, the whole thing's completed in one transaction, not two.
Yeah, no, it can't, because we book weeks in advance. The thing is, well, what we don't want to fall into is what happened to the UK at the start of the vaccine programme, where they ended up with a programme that was stop and start. What we're doing is constantly funneling numbers through. So, for instance, invites to the next category will be going out next week, and from there, further and further invites. So we've constantly got a flow of people going through the centres. What we don't want to do is just book 1 week in advance and then find that we haven't got the people. So people register, and then when the appointment slots become available, we contact them. So that is the most efficient way of doing it, to make sure we've always got people in the funnel to go through the vaccination.
And the good news that I put out the other day that I got from my source, that you're expecting now to really ramp up, that you are getting extra supplies. We're talking about thousands a day, aren't we, now?
Yes, we should be moving from tomorrow to about 1,000 people a day, 5 days a week, being vaccinated. We could spread it over 7, but again, it would be the same number, just spread over 7 days. So we're moving the hubs to 5 days, where we can get about 1,000 people a day through. And also at the end of March, where we're looking at additional supplies, potentially on top of what we were expecting, of around about 10,000 vaccines. And that will actually ramp things up even further.
Okay, one more for me, then we'll have a break and we'll do a section, in fact 2 sections about public questions that have been coming in. I didn't get a chance to ask this one because there's so many other things to ask. When all construction work was ending, except for government, essential work, does that include the prom? I mean, I know they're not working there today, but is the prom stopped or is that carrying on?
My understanding is work sites have stopped, so as far as I'm aware, I think that includes the promenade.
I did come under.
Don't hold me to gospel. I've been so busy looking at the health side of things, Paul.
I do. I'm
perfectly honest. I have lost a bit of track of what's happening with construction to a certain extent.
I do understand,
but I think it does include all work sites.
And when do you think, it was my final one, and this is just crystal ball gazing, it's not going to be a 3-week lockdown, is it? I mean, it can't possibly be now, because you're going to have to allow X amount of time from the last unexplained COVID case, and that probably could be 3 weeks added on, right? I mean, we're talking 6 weeks here, aren't we?
Yeah, I don't think we can. I don't think we can crystal ball gaze. I mean, obviously, the further we go out, the less likelihood it looks like we're going to be able to stick to the 21 days. But the important thing is that we keep the island safe. We'll make assessments like that probably late next week. Once we know what the situation is, because at the moment we are, as I've said, going to continue to see cases rise quite steeply, because this is all seeding that happened before the lockdown came into effect. So the measures we introduced, there's a 7 to 8 day period before you start seeing the effect of that. So like you say, that will be the middle of next week, Wednesday, Thursday time, before we start seeing the effect of what were the measures we took earlier this week.
And I should just ask, I mean, the situation in the schools, a lot of people said this was, a car crash about to happen. Regrets, things have gone wrong here, things have done better. Do you take responsibility?
I think in relation to the schools, to be honest, there's not much more you could have done. We went to hub schools as quickly as possible. We've got to try and keep children's education going. I've always said very clearly that we've got to be careful that the cure isn't worse than the disease. And children's education is exceptionally important. Again, look to the UK and the amount of time and education that children have lost as a result of this. So we did try and keep it going. It just became unpractical. It could well have, it's always been a risk, and we'll accept that. It's always been a risk we've been carrying, that there could have been infection in the schools. And unfortunately, on this occasion, it's happened. We've said before, and so has the Director of Public Health, there but for the grace of God, when we see things in other countries, that we've been lucky. On this occasion, our luck ran out.
How many times the Director of Public Health say it doesn't matter about the variant so much, it'll take 7 days to come back? It was extremely important, because once it was proved it was this Kent variant, which is so aggressive and hits younger people, obviously, that could have changed things earlier, couldn't it? If you
it didn't. It wouldn't have mattered. The actions we took are regardless of variant. If you were in a mitigation strategy, then the genomics around the virus matters, because you want to try and dampen down. But what we're looking at is not dampening down, we're looking at eliminating. So it doesn't matter if it's Kent, it doesn't matter if it's the old variant, it wouldn't matter if it was the Brazilian variant. The actions we take would still be exactly the same.